Bismillahirrahmanirrahim. Today we are going to discuss the salivary gland tumors. We know that the salivary glands are the very common targets of inflammatory diseases in the form of infections, the fungal infections, bacterial infections in the form of salidinitis, and also the salivary glands, they are the targets of autoimmune reactions. For example, as we have discussed in our last lectures, the Sjogren syndrome. Similarly, the salivary glands are also the targets of neoplastic conditions, and also sometimes tumors from elsewhere may metastasize into the salivary glands. One example is the squamous cell carcinoma, which commonly metastasizes into the parotid glands. Now, coming to the primary tumors of the salivary glands, the two common benign tumors that occur in the salivary glands are the pleomorphic adenoma. We should think about the name pleomorphic. Pleu means many and morphic means structures. So the pleomorphic adenoma, they are benign tumors which appear in various structures. The second benign tumor that occur in the salivary gland is the Warthin tumor. And it is known as the Warthin tumor because it was named by a pathologist named Warthin. And pathologically, we call the Warthin tumor as the papillary cyst adenoma lymphomatosum. There are three names. Papillary, by which we mean the epithelial cells which form papillary projections. And the cyst adenoma, by cyst adenoma, we mean that the ducts, they are converted into cyst-like spaces. And the lymphomatosum means that the neoplastic cells, they are infiltrated by the lymphocytes. The most common malignant tumor that occur in the salivary glands is the mucoepidermide carcinoma. Mucoepidermide. Muco means mucus secreting, and epidermide is the squamous epithelial cells like that are found in the skin, epidermide. Here one thing that I want to mention, that on clinical grounds, the diagnosis of either it is a benign tumor or it is a malignant tumor, it is difficult because most of the salivary gland tumors, they appear with symptoms and signs that cannot differentiate one tumor from the other. And the other important fact that the mostly the clinical sign symptoms, they appear very late. So the differentiation from a malignant to benign and various benign tumors, it should be made on histopathologic evaluation. By that we mean that either we should use an FNAC, fine needle aspiration cytology, or sometimes biopsy, taking a tissue by through a surgical procedure, whatever may be the appropriate. But the histopathologic evaluation is essential to differentiate between benign and malignant tumors and various types of benign tumors, for example, pleomorphic adenoma or Warthin tumor. So, the histopathologic evaluation through an FNAC or a biopsy, it is essential for the diagnosis of the salivary gland tumors. Now, before going to discuss the salivary gland tumors, we make a brief review of the normal structure in the salivary glands. Actually, the salivary glands, they are composed of a large number of acini, and each acinus drain its saliva into an intercalated duct, and intercalated ducts from different acini, they unite to form the striated ducts or intermediary ducts, and these ducts then unite to form the excretory ducts which drain saliva into the oral cavity. Now coming to the SNS or salivary glandular SNS, the SNS they contain secretory end pieces, which we can say is the functional unit of the salivary gland or the salivary gland SNS. And these units are called as the secretory end pieces. Now, the secretory end pieces they are lined by the serous cells which make watery secretions which contains more water and is comparatively in a dilute form, and the mucus cells they secrete the mucin, which is the thick mucus secretion. So the salivary glands and particularly the secretory end pieces of each SNS in a gland, it is lined by the serous cells and mucus cells. Now, in addition to serous and mucus cells in the salivary glands, there are the myoepithelial cells. The myoepithelial cells have smooth muscle-like properties and they can contract, and they are necessary for to contract and to push the saliva through the salivary gland ducts. So problem may arise in the secretory end pieces, in the serous cells, mucus cells, and also in the myoepithelial cells. Now from each SNS, the different intermediary ducts they unite to form the striated and excretory ducts, and they finally drain into the oral cavity. The ducts in the salivary glands they are lined by the cuboidal epithelial cells. So we get four components normally in a salivary gland SNS, which are the serous cells which secrete watery secretions, the mucus cells that secrete mucus, and the myoepithelial cells and the ductal cells in the which line the ducts, and they are the cuboidal epithelial cells. Now the saliva, which is originally formed of watery and mucinous secretions, when it passed through the ductal system of the salivary gland, changes occur in the saliva. Many contents like electrolytes, water, it is absorbed, and some uh, contents are secreted to make the final composition of the saliva. And we know that the saliva contains the various enzymes like salivary amylase, and it also contains the antibodies like immunoglobulin A, and all these are important along with lysozymes which are involved in killing the bacteria and making the final composition of the saliva. Now, what happens in pleomorphic adenoma, which is uh, a benign tumor that occur in the salivary glands, that the epithelial and myoepithelial, these cells undergo neoplastic transformation. The cells they become neoplastic, and we know that what is the difference between a normal and a neoplastic cell. So once the epithelial and myoepithelial cells are transformed into the neoplastic cells, what happens that in pleomorphic adenoma there is metaplasia of the neoplastic cells into mesenchymal tissue. The parenchymal tissue undergo metaplasia, and as a result of the metaplasia it is converted into mesenchymal tissue. We know that metaplasia is uh, a reversible condition in which one type of mature adult epithelium is replaced by another adult mature epithelium. And normally, we have discussed in our lectures the metaplasia that occur in the uh, upper respiratory tract of the uh, those who are heavy smokers, in which the columnar epithelial cell, they are replaced by squamous type of epithelial cells and undergo squamous metaplasia. And similarly, in conditions like the Barrett esophagus in the lower distal esophageal portion, where the columnar epithelial cells, they replace the squamous epithelial cells. So metaplasia, by definition, it is the condition in which one adult epithelium is replaced by another adult epithelium. So here in these conditions, once the normal epithelial cells, they have transformed into neoplastic cells when they become neoplastic or cancerous cells. So these neoplastic cells, they then undergo metaplasia. And what is the result of this metaplasia? That the neoplastic epithelial cells, which are parenchymal in origin, they are transformed into mesenchymal cells. Now, the resulting mesenchymal tissue may be either in the form of chondroid tissue. By chondroid, we mean cartilage forming cells. It may be in the form of myxoid tissue. By that, we mean the mucus secreting cells, and sometimes a mixture of the chondroid and myxoid tissue, which is the chondromyxoid. Now, histologically, as I said, the pleomorphic adenoma, the pleomorphic means, pleu means many and morphic means structures. So the pleomorphic adenoma appears with many different shapes. The two major components uh, in the pleomorphic adenoma as of the salivary gland is the parenchymal structure and the mesenchymal structure. The parenchyma of the salivary gland, which is composed of ductal epithelial cells, and what happens to these ductal epithelial cells, that they undergo metaplasia, and then these cuboidal epithelial cells may form ducts, or they may form many tubules, or they may form solid sheets. And sometimes these epithelial cells, they may undergo squamous, by what we mean that they may form squamous epithelium, and sometimes the mucus secreting cells, and the oncocytic cells. So the in pleomorphic adenoma, the parenchymal tissue may undergo metaplasia after neoplastic transition. Now, the other parenchymal component in the salivary gland, particularly in pleomorphic adenoma, are the myoepithelial cells. What happens to the myoepithelial cells? That they lose their spindle shapes, becomes polygonal and sometimes oval shaped, with pink color appearing eosinophilic cytoplasm. And they may form sometimes plasmacytoid cells. Plasmacytoid name is derived from the plasma cells, and we know that the plasma cells, they are formed from the B lymphocytes, and the plasma cells, they are, the function of the plasma cells is to secrete antibodies. Now sorry, the appearance of the plasma cells under the microscope is that these cells, they are oval shaped, and the nuclei in these cells, particularly known as the cartwheel nuclei, which appears like the wheel of a cart with spokes. And these nuclei, they are eccentrically located, having a pink color eosinophilic cytoplasm. So the neoplastic cells, which are derived from myoepithelial cells in pleomorphic adenoma of the salivary glands, they are known as the plasmacytoid cells. By that we mean that they resemble the plasma cells. They are oval shaped, their nuclei are eccentrically located, and they have pink color eosinophilic cytoplasm, and therefore they resemble the plasma cells, and for that reason they are named as the plasmacytoid cells. Now, the second component of the salivary gland after the parenchyma is the mesenchymal tissue. And since the parenchymal tissue, the neoplastic parenchymal tissue, it undergo metaplasia into mesenchymal tissue, or the which will appear as the stromal connective tissue. And in pleomorphic adenoma, the mesenchymal tissue is transformed into myxoid stroma, or sometimes fibrous stroma, which contain fibroblasts, and sometimes the mesenchymal or stromal connective tissue in pleomorphic adenoma may form hyalinized acellular masses, pink colored eosinophil stained hyalinized masses. Now, under the microscope, uh, here we can see that the picture A, which shows a low power view, and as the pleomorphic adenoma is a benign tumor, so it is well demarcated, and it is surrounded by a well defined capsule, and as it is a benign tumor, it does not invade the surrounding normal component of the salivary gland. And in this picture, in picture A, we can see the uh, tumor and the well-defined uh, capsule, which is a characteristic of the benign tumors. And here we can see some uh, normal parenchymal tissue. The second picture, it shows a high power view and the epithelial cells and myoepithelial cells, and they form a chondroid mixture, cartilage forming cells. Now, as its name indicates, pleomorphic, pleo means many and morphic means structure. So, it has got very variable appearance, and the parenchymal component of the salivary gland, which itself forms very variable structures, it is situated in the mesenchyma, which also form very variable structures. For example, it may form fibrous tissue, it may form the acellular uh, necrotic tissue, or sometimes it may form the mucus secreting cells or the myxoid tissue. Now, clinically, the pleomorphic adenoma appear as painless, there is no pain, and the pleomorphic adenoma appears as slow growing, mobile. By that we mean that we can mobilize it, and it will appear in the form of discrete masses. And the common salivary gland affected by pleomorphic adenoma is the parotid gland. So, under the microscope, the pleomorphic adenoma is characterized by a mixture of epithelial and myoepithelial cells, which are the parenchymal cells, and these cells become neoplastic, and after they have undergone neoplastic transition, they undergo metaplasia. And similarly, this uh, neoplastic and the tissue, the parenchymal tissue that has undergone metaplasia, it will be lying in the background of a connective tissue stroma, which is of mesenchymal origin. And as the mesenchymal tissue in pleomorphic adenoma is also undergo metaplasia after neoplastic transformation, and it may form the mucus secreting myxoid tissue, the chondroid tissue, which are composed of cartilage forming cells, and sometimes even the osseous tissue, which are the bone forming cells. And for this reason, being myxoid, chondroid, or chondromyxide or osseous appearance of the tumor. These tumors are also known as the mixed tumors. And initially, it was a time that it was thought that these tumors, they were appearing from the germ cells. But later on, it was confirmed that these tumors, they do not arise from the germ cells, but actually the uh, neoplastic tissue or the neoplastic cells that are formed in these tumors, they undergo metaplasia and they are transformed into mesenchymal tissue structures. Sometimes these tumors may appear one component to be more predominant. For example, the tumor may appear myxoid, composed of purely mucus secreting cells. Sometimes it may appear as chondroid, made up of cartilage forming cells. And in some situations, the tumor appears as a mixture of myxoid and chondroid tissue. The pleomorphic adenoma, the treatment of the pleomorphic adenoma, that the tumor should be surgically excised. But here one thing important that I want to mention, that in these tumors wider resections are advised, because if a neoplastic tissue remains after surgery in the salivary gland, it may recur and again post-operatively, after some time, again it may form the pleomorphic adenoma. One thing that I want to mention here, that doing surgery on the salivary glands, particularly the parotid gland, it is essential to take great care, because we know that facial nerves, particularly the uh, uh, facial nerve and other nerves, they pass through the parotid gland. So if we do surgery and if we surgically remove a tumor or the parotid gland, we may cause damage to these nerves. Particularly if the facial nerve is damaged, so post-operatively the patient will present with the Bell palsy and other uh, complications that arise from the damage to the nerves. Sometimes a malignant tumor may appear in pleomorphic adenoma. By that we mean that the benign tumor is converted into a malignant tumor. And this transition of pleomorphic adenoma to a malignant tumor is rare. But if a malignant tumor appears in pleomorphic adenoma, it is called as carcinoma x pleomorphic adenoma. Carcinoma x pleomorphic adenoma means the formation of a malignant tumor in the pleomorphic adenoma, which is a benign tumor. Now, the clinical presentation uh, of the pleomorphic adenoma, as I mentioned, that it appears in the form of mobile discrete masses, and the common site for the pleomorphic adenoma in 90% of the cases, it is parotid gland. And as we know that it is situated below and in front of the ear, so we may see discrete masses which are mobile and mostly which are painless. The patient appears with these signs and symptoms. After the parotid gland, the common site for pleomorphic adenoma is the palatal glands, which are the minor salivary glands. The sublingual glands, it is a rare site for pleomorphic adenoma, and uh, the sublingual glands is, we know that these salivary glands are situated below the tongue, and pleomorphic adenoma is rare in the sublingual glands. Now, the second benign tumor that appear in the salivary gland is the Warthin tumor. And it has got its name as the Warthin tumor because it was initially discovered by a pathologist whose name was Warthin. And here again, it is a benign tumor and it commonly affects the parotid gland. The pathological name of the Warthin tumor is the papillary cystadenoma lymphomatosum. We will break this name into its three components. Papillary means that the epithelial cells they form finger-like projections or papillae, and cystadenoma means that the ducts in the salivary gland they grow inside and become filled with serous fluid and cellular debris and form cysts. So cystadenoma are the cysts that are formed by the ducts in the salivary gland. So the papillary projections that are formed by the epithelial cells they will project into the ducts which are formed by the which are in the form of cystic ducts which are formed by the growing uh, ducts, and these cysts which are formed by the ducts they are filled with the serous fluid and the cellular debris, and the papillary projections project into these cysts. By lymphomatosm we mean that these tumors are infiltrated by lymphocytes, and these lymphocytes sometimes may form structures like germinal centers in a lymph node. So the papillary cystadenoma lymphomatosum is the benign Warthin tumor that commonly affects the parotid gland. Here the signs symptoms are of the Warthin tumor is that the Warthin tumor is a slow growing tumor and it takes a lot of time for symptoms to appear, and the commonly, these are painless tumors, but the symptoms in a Warthin tumor they present because of the physical presence of the tumor, particularly in the parotid gland that will push the other structures. So the symptoms and signs they are mostly because of the physical presence of a mass. The tumors they appear as swelling or a bump below and in front of the ear which is painless, and we know that there are nerves that pass through the parotid gland with particularly the facial cranial nerve. So uh, sometimes the symptoms are because of the physical presence of the Warthin tumor in the parotid gland which will cause compression of the nerves, and the symptoms which are caused by the compression of the nerves in the parotid gland they may appear in the form of impaired hearing, ear aches, or tinnitus which is ringing in the ear, and sometimes uh, paralysis. For example, the facial paralysis it will lead to Bell's palsy, in which the structures on the side affected by the uh, tumor and the site where the paralysis of the facial nerve occurs, there will be uh, weakness in the muscles, and uh, they will appear in the form of Bell's palsy, which has got its typical appearance. As we know that all tumors, mostly the tumors, the exact etiology of the tumor, it is not known. But whatsoever we know that genetic mutations and chromosomal disorders, the genetic mutations in the form of tumor suppressor genes, oncogenes, and similarly we can explain the cause of the uh, Warthin tumor is the exact cause is not known, but the tumors they are the result of genetic mutations and chromosomal disorders. Some risk factors that are associated uh, with Warthin tumor, we divide them into modifiable risk factors. For example, it has been uh, said that smoking is very much associated with the appearance and the pleomorphic with the appearance of the Warthin tumor. So it is a modifiable risk factor because we can advise the patient to quit smoking. And at least we remove one risk factor for the Warthin tumor. But there are some non-modifiable risk factors. Non-modifiable risk factors are those where we can't do more. For example, we can't change the gender of a person. We can't increase or decrease the age of a person. So these are the non-modifiable risk factors. So in relation to the Warthin factor, one risk factor is smoking, which is modifiable, and we can advise the patient to quit smoking. However, some non-modifiable risk factors are those Warthin tumor is more common in males than females, and it is a tumor that commonly affects the aged people, and these are the non-modifiable risk factors. Now, under the microscope, we can see the papillary projections of the epithelial cells which form papilla, and the papilla project into the cysts. And there is infiltration of the uh, lymphocytes. So, this tumor is named as the papillary projection, cystadenoma, the cyst-like spaces that are found by the ducts, and lymphomatosum with infiltration of lymphocytes, and sometimes these lymphocytes form typical germinal centers as that we see in the lymph nodes. Now, diagnosis of the Warthin tumor is that the presence and feeling of a mass at the region of the parotid gland below and in front of the ear. Certain imaging procedures like X-ray, ultrasound, computed tomography, and magnetic resonance imaging, we can use these diagnostic procedures. And as I said, that the signs, symptoms, diagnostic procedures, they can help us to make diagnosis. But the confirmation and the confirmed diagnosis of the tumor, it will be made by the fine needle aspiration cytology like the FNAC and the tissue biopsy. When we take a piece of the tumor or the tissue and make a stained tissue slide and examine it under the microscope. Now, the Warthin tumor is a benign tumor, and surgical removal is the is all what that is needed. But during surgical procedure, very care should be taken to save the nerves, because if the nerves, particularly the facial nerve, if they are damaged, the patient will appear post-operatively with uh, problems like Bell's palsy that are associated with the damage to the nerves. Now, coming after discussing the two benign tumors that occur in the salivary glands, that were the pleomorphic adenoma and the Warthin tumor. But the most common malignant tumor that occurs in the salivary glands is the mucoepidermoid carcinoma. Here again, we uh, consider the name mucoepidermoid. Muco means mucus secreting cells, and epidermoid means epidermoid, the squamous epithelial cells which form the epidermis of the skin. So the tumor is composed of mucus secreting cells, squamous cells, and sometimes cells which are intermediate between the squamous and mucus cells. And these intermediate cells, they are the hybrid cell type, and they may have both the and squamous cell features, and also make the mucus filled vacuoles. And these intermediate cells are the hybrid cells. They have the potential to differentiate either into squamous cells, cells with squamous epithelial cell features, and also sometimes into mucus secreting cells forming the mucus filled vacuoles. The mucoepidermoid carcinoma, which is the most common malignant tumor, that occur in the salivary gland, we divide them into low-grade tumors and high-grade tumors, differentiated tumors and undifferentiated tumors. Differentiation is a very good prognostic factor in any tumor. If a tumor is composed of cells that can be differentiated, and the tumor cells or the neoplastic cells, they show more similarity to the original cells from where they are derived. For example, the squamous epithelial cells, columnar epithelial cells, cuboidal epithelial cells. So if the tumor cells, if they simulate the original cells, we say that these are differentiated. And now we divide this differentiation into well differentiated, moderately differentiated, and then we turn into the undifferentiated form. And more the cells of more the neoplastic cells are undifferentiated, more serious will be the outcome of the tumor, and more difficult it will be to diagnose the tumor, to treat the tumor, because the highly undifferentiated tumors, they are very invasive, and compared to the differentiated tumors, they can easily metastasize to distant organs, and metastasis is comparatively rare in well differentiated tumor as compared to highly undifferentiated tumors. So well differentiated tumors or relative differentiated tumors are the low grade salivary gland tumors or the mucoepidermoid carcinoma. It has a 5-year survival rate over 90%. If the mucoepidermoid carcinoma is composed of differentiated cells or relatively differentiated cells, and if it is a low grade tumor, but if under the microscope we cannot differentiate the cells of the mucoepidermoid carcinoma with relation to its simulation to the original cells, then we say that this is highly undifferentiated high grade neoplasm. And as compared to the low grade tumors, the high grade tumors are strongly invasive. They affect the surrounding structures, and therefore the surgical excision or removal of the tumor becomes very difficult. And the high grade tumors, they easily metastasize to uh, distant organs, and therefore the survival rate or the 5-year survival rate of the high grade tumors, it is less than 50%. The histological appearance of the mucoepidermoid carcinoma is that the fluid filled cystic spaces and the squamous epithelial cell simulating the epidermoid cells, they will appear under the microscope. Now coming to the summary, the two benign tumors are the pleomorphic adenoma and the Warthin tumor, and the most common malignant tumor in the salivary gland is the mucoepidermoid carcinoma, and collectively the parotid gland is the most common gland that is the target for benign and malignant tumors. However, it is not uh, a documented statement that only the parotid gland will be involved. Other glands can also be involved, but the most common is the parotid gland. Thank you very much.